I'll try to do it from here. Thank you very much. And I not only have the challenge of being the last speaker, but I have to follow the example of Louise and Manish, who showed what you can do in 10 minutes. So this, I feel, is my biggest challenge going forward here. We'll try to make this work. I'm not here to provide you with any new innovation. I am here to congratulate you on your moonshot. I think this is a huge, huge challenge you've given yourselves. We were here a year ago in Dubai, in the region, the first time we ever brought rare diseases to the region to announce the UN resolution on rare diseases. And it was the right time and place to do it. But now I'm here actually to give you an even bigger challenge. And I think this is the right place to do it. I think we've talked a bit about that patient journey. You've already talked about it a great deal. One of the important things that I want to point out here is that when we talk about the patient journey, as you know, for rare diseases, it is not a straight line. It is a line in which you're constantly looping over and over again with, as we said, misdiagnosis, wrong diagnosis, no access to treatment. It's one in which you can get stuck so many places. And this is what we're all about at Rare Diseases International. And that is creating these rare disease networks. And this is what you've been talking about here. So I'm going to talk to you about what you're proposing with your rare disease centers of excellence network here, in not just in Riyadh, but in the region, and give you the challenge of not just building a spaceship to the moon, but one that's going to carry. Actually, our estimates from Rare Disease International is that there could be between 400 and 500 million people that have a rare disease. And we want you to build that spaceship that will take each and every person with you. Because the goal that we have at Rare Diseases International, the Patient Alliance, is that every single patient that has a rare disease or an undiagnosed disease will have access to a diagnosis, and we'll have access to a specialist, and we'll have access to treatments. Thank you. What we do know today is, as you've talked about, the challenges of getting access to the diagnosis, getting access to a specialist. And I think what Mark brought forth is the challenges of developing a therapy. But to tell you the truth, today, the therapies that are available, only about 10% of patients who should be eligible for that therapy are getting access to it in the most developed countries. And across the globe, less than 1% of patients who could benefit from a therapy for a rare disease get access to that treatment. Now, that is indeed the true tragedy. I mean, we often ask people, what's worse? To not have a treatment for your disease, or to know that there's a treatment there and you can't get it? To not get an access to a diagnosis, or to know that there is the opportunity to be able to diagnose that disease and not get access to a diagnosis. And what we know is that in the globe, around the world today, less than 10% of people get access to a diagnosis when there is a diagnosis there. And as I say, less than 1% of people who could get access to that therapy gets access to it. So this is what we're all about here. Rare Diseases International is the only global patient alliance. We are in 150 countries. We have 88 member organizations, but altogether we represent more than 200 million patients. And this is our goal then, is to make sure that not only those 200 million that we do know, but all 400 million get onto that spaceship that you're building to the moon. We've got to take everybody with us. It's what the United Nations said. It's what our mantra is, and that is leave no one behind. We know that as rare disease patients. We know that as a community that's struggling to get attention for rare diseases, and we have that obligation to make sure that each and every person that is affected by a rare disease on this planet could have an equal chance to get access. And we can do that with the idea of a rare disease network. So this is the challenge, is that there are inequities right across the globe. There are inequities within a country, but certainly the inequities are most in terms of low and middle income countries. They're most in terms of patients who are living remotely geographically. They're most for people who do not have the education or the kinds of supports that you might find. So that's the obligation that we all have. And how do we actually make sure that we take everybody with us? So it's formalizing a global network. You've talked about it here. You develop a rare disease center of excellence. You make sure that people get access to the resources. You share that knowledge and training. And our challenge is to say, let's share it across the globe. Let's bring everybody along. So we're going to take the clinical networks that exist today, and we have seen an amazing example of what you've got here, and it's hidden away as a gem. I don't think very many people know what you've developed here. I mean, I was speaking today about what's, or just heard today about what's happening in Dubai and what's taking place right now here in Riyadh. Most of us don't know that, but you know what? You have no right to keep that secret. You have every obligation to share those resources, to share that knowledge, and to be able to provide benefits to others. So we're going to take those clinical networks. You heard about the European reference networks in a previous discussion. Those are serving people right across Europe. That was the concept under the European reference networks, that where you've got specialists, where you've got experts, they're able to support. Everybody living in Europe, theoretically, has access to a diagnosis and to a specialist. They can't always get there, they don't always know about it, but that's the obligation. And this is our vision to say, everybody across the globe has that equal chance. So we take the networks and we bring them together, and what we're going to do then is to bring them together globally under global policy. The reason Rare Diseases International was formed was actually to create a global umbrella for all the groups coming together. Some of you may have been aware 2019, when the UN Declaration on Universal Health Coverage came out, Rare Diseases International was there to actually advocate that in that declaration, it recognizes rare diseases as an underserved population. And the importance of that was to say, as countries bring in universal health coverage, make sure you include rare diseases in all of your policies and programs. We were here in Dubai, as I said a year ago, in order to announce the UN resolution. And that was very, very important for us, because what that resolution said is rare diseases is not just a medical condition. Rare disease is not clinical. Rare disease is a social condition. It's an economic condition. It's an educational condition. It's one that affects in terms of equity. And in order to treat rare conditions, you need to include all of those other aspects of it. And I think you know that in what you do. And I know that when you talk about integrated care, but it goes way beyond then the care. So that's what the UN resolution is about. And so in this global network, what we're trying to do is to actually bring that together. Now, what Louise and Namish talked about, though, are the important building blocks of that global network. And that is, the only way it's going to work is that if we can connect it digitally. The only way it's going to work is if we take all the data that's being generated and we can analyze it globally so that we can bring the benefits back to all. So those are the tools that are going to enable us to do that. But their tools are only tools, and they're not going to do any good unless we actually put them into practice. And that's what we are all about. So this past 3 years, we have been working to try to help identify where are some national centers of excellence. Can we begin to put them together into regions so that we have a Southeast Asian region? I just came back from Singapore, came directly here from Singapore. I'm going to be going from here to Europe for their International Research Consortium, and then on to Bogota to talk in Latin America, because we're trying to build these regional alliances everywhere. The only way we can do it in order to get to everybody is to take the expertise to be able to share it across the regions. And then those regions then come together in terms of a global hub. And as you know, with some of these ultra rare diseases that you heard about, those specialists are not going to be available everywhere. So can we get that patient, however remote they are, to get to the specialist regardless of where they are? And as we know, some of those specialists are not necessarily going to be in the most well-advanced system. So that's the goal, create that global network. We have partnered with the World Health Organization. So under the Memorandum of Understanding with them, we have been developing this network, or at least conceptually, for the last 3 years. We're going to be renewing our MOU with WHO. I just met with them last week, and they came back to us with one message, and that's what I'm going to deliver to you today. The WHO has now given us a public health officer for rare diseases. We have a technical officer within the WHO for rare diseases. First time that's ever happened. But what they're saying to us is enough top concepts, enough division, we have to execute. What we want to see in this next year coming forth are proof of concepts on the ground to demonstrate that you can have national centers that can be connected regionally and that could become a global network. And if we can do that, the WHO is with you. We're going to help you in terms of doing it. We're pushing for a WHO declaration for rare diseases 2024. And what that means is that countries signing on to it will be obligated then to work with us across the globe. It still means we have to do all the work. As you know, the WHO is great at putting forth policies and mandates. They're very light in doing real work. But they give you the opportunity to do real work. So that's what we're working for. And this is what we want, certainly here in the region, to be part of. I will tell you honestly, we had proposed to the WHO 3 networks. It did not include the Middle East. I can tell you we need to include what you're doing here. And it can become maybe one of the best examples of how we can have centers of excellence that can actually work across a region. So these are some of the concepts of it. This is the WHO regions and how they will be clustered. This is just some of the pictures of the events that we've had with the WHO. I will say we have been so thrilled to have the global community with us, the UN resolution. The unfortunate thing we learned about the UN resolution is it has to be renewed every 2 years. We have to go back to the United Nations and we have to show them what we did with the resolution last time. And I think the only way we're going to show them is what we can show them on the ground in terms of places like this where those centers are there. So I think that is about it. I think that was the last slide. Thank you very, very much.